Hi, this is Pete Fernbaugh. Welcome to Trinity Talk.
My guest today is Dr. Megan Presley. She's the owner and audiologist of Presley Hearing Center right here in Steubenville, Ohio. Megan, thank you so much for being here. You've made quite a reputation for yourself in a good way.
Thank you. Thank you.
In a very good way, here in not only in town, but around the tri-state area. Give us a little idea of what Presley Hearing Center is, apart from, the obvious name, but what all do you offer there? What are the services? The service lines that you offer?
So at Presley Hearing Center, we offer complete hearing evaluations for adults, for pediatrics. We remove wax if that's a problem. And of course, we fit individuals with hearing aids that need them. We also can do hearing protection to protect those folks and their hearing loss from any hazardous noise.
That's very concise. That's awesome. So, this is a problem that affects all ages. So you probably see all generations of patients, from the smallest to the most senior. I'll be polite.
Yeah, right.
What prompted you to go into this field? What sparked your interest in it?
Yeah, so from the time I could walk and talk, I said I was going to go to Ohio State and become a veterinarian.
The Ohio State.
The Ohio State, yes. And I got the Ohio State part right, went there, started taking my prerequisite courses for vet school, and just realized I don't think I'm cut out for this coursework.
Sure.
So a family member told me about speech pathology. So I started taking the courses, got into it, found it interesting, got good grades in the class. So I thought, well, this is it. I'll be a speech pathologist. And as it turned out, around junior year, we're introduced to the audiology side of things.
Sure.
And I loved that so much more. And my mother has hearing loss. She has from the time she was a small child. So that's my emotional tie to it.
Sure.
So oftentimes if you ask an audiologist how they got into it, we started out in speech, hated it, and moved to audiology.
People don't realize how precious our hearing is until it starts to go. The interesting thing about speech pathology, if I'm not mistaken, a lot of times it is connected in some way to hearing, to audiology.
Yes.
When you had that audiology course, was it like a light bulb going off? Did it just spark that, oh, this is what I've been looking for all along?
Yes, absolutely. And I think the emotional tie with my mom, growing up with her, having experienced what she experienced, having hearing loss and not having help, was definitely what propelled me into that. And you're absolutely right. We learn to speak from hearing it.
Yeah.
So especially children, kids, if there's any sort of speech delay or concern for a speech delay, typically we want to rule out hearing loss at the very beginning. And oftentimes it's usually maybe an ear infection or some wax, but that is absolutely true. Speech and hearing are related.
It's got to be such a rewarding profession to be in, because when people, and I've known people who've gotten hearing aids, and their whole personality changes once they can hear again. It's just amazing. We take it for granted. How rewarding is that for you when you have that kind of patient who's just, their family has to shout to be heard? What's that?
Right.
What's that like?
Yeah, it is a rewarding experience, and not only to see it from the patient themselves, but their family members, their spouse, their friends. And a lot of times patients don't realize what they're not hearing until they hear it.
Yes.
So to hear them report, oh, I didn't know my blinker in the vehicle made a sound.
Yes.
Or I heard birds chirping for the first time and they haven't heard birds chirping in decades. Or hearing their grandchildren better, those sweet, heartwarming moments is always nice to hear. And of course, from the family members, the spouse, I don't have to repeat myself as much, or I don't have to yell to get their attention anymore. It's a really cool thing to realize how much of an impact you're having on that person's day-to-day.
I know, I just hear so many great things about the work you do. What is the most, before we get into all the details, and I want to cover how you were our Crimson champion this year, but before we get into all that, I'm just curious, was your mother of a time where they did not have the kind of technology we're dealing with now? And so basically you lost your hearing, or they'd give you one of those huge hearing aids.
Right. You just cup the ear. But yeah, mom specifically was very sick as a child. I believe what she had then was meningitis, which we weren't as knowledgeable about and what it could do and the effects that it could have. So she just remembers she was in the hospital for a long time, and when she came out, she remembered that she remembered having a hard time hearing, and my grandmother thought she was just being bad, if you will, especially if my mom wasn't looking at her, she couldn't hear her. So it was really just one ear that was affected, but that can cause issues, even if it's just one, definitely both, but when one ear is affected with hearing loss, it can cause problems. So she really taught herself how to read lips as she grew up and got older. And once I became an audiologist, I was then able to fit her with hearing aids. So,
I was trying to find a polite way to ask about that, about stepping on a landmine.
Yeah.
That had to be the most rewarding of all of your patients.
Yeah, that has been very exciting. And my dad wears hearing aids as well. He's your typical noise-induced hearing loss. He worked around a lot of hazardous noise all of his life. And then mom in particular, we actually just recently had a little surprise thing with her. She had worn, not to get too into the weeds, but she had worn what we call a bicross system, where I thought her one ear that was affected from when she was a child had no usable hearing. So she would wear two devices, but the device on that ear would actually pick up the sound and send it to the better hearing ear. So if you have hearing loss in one ear, we can still make that work. Or no hearing in one ear, we can still make that work. But recently I fit her with some new devices, and I thought, Mom, let's check your hearing. I haven't tested you in a while. Shame on me. Yeah. And I thought, I realized, oh my gosh, you do have more hearing in that ear than I thought. So we fit her with two hearing aids, one on each ear, and she is just doing fantastic. Yeah, she called me. She had left. My mother's my patient care coordinator at the office. So it is she and I together. So she had left the office to run an errand, and she called me, and I said, "Are you okay?" And she said, "Yeah, I just had to call you. I heard a siren from an ambulance." She said, "Much sooner than I would have with my previous technology." She said it used to be that it would have to almost be right on me before I heard it. And she said I was able to hear it before I even could see where it was. So it's really amazing how you can help. You don't even think about stuff like that, as hearing people.
It's a testament to how far the technology has come.
Oh, definitely.
Yes. And that just has to, whenever I talk to a specialist, and that's the one thing they're jazzed about is the technology.
Yes.
And how astoundingly sophisticated it is.
Yes.
How it's advancing rapidly. That's a great story.
Yeah. And the technology has come, and it's still developing constantly. I tell patients this all the time. Hearing aids of the past used to turn everything up. Yeah. Everything up all at once, and that's why everybody didn't like them, because it turned up all the noise, right? In the hope to turn up speech. But hearing aids now don't do that. They use AI, they analyze the environment, they determine what's noise, what's speech, and they help to alleviate those background sounds and then pick up on those speech sounds you typically miss.
I would imagine there's a Bluetooth element.
Oh yes, yeah, and even the most basic hearing aid comes with Bluetooth now. Some of my patients will say, well, I don't need the most expensive one with all the bells and whistles and the Bluetooth. And I'm like, look, even the most basic one comes with Bluetooth, so it's okay.
That's incredible.
Yeah,
that's it. What was it they used to stick in their ear back on?
Oh yeah, the ear horn.
Ear horn. Long way we've come since then.
Luckily we don't have to carry one of those around. We have the very discreet devices that can be put on and in your ears, and no one sees it.
Well, about a year ago, you were nominated to be our Crimson Champion and Crimson Connection Champion for 2025. Yeah. Vanessa Maurer nominated you.
Yes.
And I can see why.
Oh,
you're everything that we're looking for in a Crimson Connection Champion. I have to really be careful how I say that. That's quite the tongue twister.
Yeah, it is. It is. That's hard.
I know people do not seek these nominations. It's not a contest.
Sure.
It's usually a surprise. People are nominated. What was your reaction when you found out that you'd been nominated and that you were going to be the champion?
Yeah. So Vanessa actually shot me a text. Vanessa and I are colleagues. She has Hometown Pediatric Solutions in Wintersville. Okay. And I do believe she's actually opening another location in Cadiz, Ohio. But she and I partnered up with May is Better Speech and Hearing Month. And I reached out to her to do a project together. So she's a speech pathologist, I'm the audiologist. So it just made sense for us to team up. So she and I are pretty good acquaintances, and she texted me and said, hey, I need your email. I'm nominating you for this award. And I was like, Vanessa, I'm like, thank you. I'm like, but that's not necessary. So then when I realized what it was, I had attended the luncheon previously, just as a guest. And I thought it was just such a great element to bring to the luncheon to recognize, because there are so many good things happening in our community. And I think that oftentimes that's not highlighted enough. So to be able to have us there and say, hey, there are all these good people doing good things in the community, strong women, and raise awareness for heart health is a really, I think, a fantastic thing.
And there is a connection
Is it?
in here and heart health.
Yes, yes.
Yeah, as you pointed out, the luncheon does highlight two important things. Heart health, those who are giving back to the community.
Yeah.
And you're certainly doing that. How important is that element beyond just having patients in? How is, because people know you beyond, they may never have been a patient, but they know of Presley Hearing Center. How important is that community element, and how do you reach out to the community and involve Presley Hearing Center in the community?
Right, yeah, I think the community element is huge, and I think especially in Steubenville and the Ohio Valley, it's a very special place. And being born and raised here, I love that I can provide exceptional hearing healthcare to the community that raised me and shaped me into who I am. So whatever I can do to give back to the community, I do, whether it's, sponsoring something or whether it's hosting a free clinic, a free hearing aid clinic at a local church or a facility or an organization like Our Place or Prime Time, where I can offer my services, at for free to check their ears for wax, test their screen their hearing.
Yes.
Whatever ways we can give back to the community is a huge deal.
And I bet you have a great turnout for those events.
Yeah. Patients like to see if their ears have wax. They like to look. They like to be able to see what I'm looking at. And then if a patient's kind of wondering, I'm not sure if I have hearing loss or not, it gives them a little bit more information. And then of course, if they already have hearing aids, I'm able to assess those, clean and check them for them. So it's very helpful.
That's very generous of you to do. I mean, those are expensive services, so it's very kind of you. I know you're always out and about, and that's we're just very grateful to have you in the community.
Sure.
Let's get into this connection between heart health and hearing care. Well, first, I think the biggest point that you made in the notes, I don't want to sound like I know more than I actually do. You informed me very well. I never thought of this before I read this, and it made sense. It's one of those things that you just don't think of naturally. Hearing care is health care. I think that's such an important point.
Yes.
There's so many, every aspect of our bodies is health care. But why do you think, first of all, explain that statement, hearing care is health care. And then second question, why do you think people don't automatically make that connection to health care?
Yes, so at Presley Hearing Center, we feel that hearing care is health care because it always goes back to, and I'll probably say this word 50 more times, it goes back to the brain.
Yeah.
It is our brain that's hearing, not our ears.
Right.
So it's the ear's job, the auditory system's job, to get the sound from the environment up into the brain. Now, if there's a breakdown somewhere in the auditory system, that's when hearing loss is there, and that can become a problem. So then the brain isn't getting that auditory stimulation that it once did. So a patient may start to seclude themselves. They may not want to go to the events that they used to go to because they can't hear. So then that leads to isolation. So then they're at home, they're not conversating or being social with loved ones, family members, friends. That can lead to depression.
Yes.
So there it just kind of snowballs. So it really is an important part of your overall health care. And I think it hasn't been looked at that as much because of a couple things. I think hearing loss kind of gets put on the back burner.
Sure.
It's not painful in a ouch, that hurts sense. It can hurt us in other ways, from, if a spouse is mad at us or something because we didn't hear them. So it gets put on the back burner for that reason, and we can compensate.
Yeah.
We can compensate for a long time. It's years before someone notices they're having trouble till they're in my office to see me.
Right.
Like 7 years.
Really?
Yeah.
7 years.
Yeah.
That's the average.
The average is 7 years. So that's 7 years of asking for repetition, potentially social isolation, depression, and the brain working harder. Your brain literally works harder with untreated hearing loss.
And can that lead to more fatigue?
Yes.
Exhaustion?
Yes, it can lead to fatigue because your brain's working harder. Patients can sometimes be exhausted. They come home and they're like, oh my gosh, I'm so tired, because they were trying so hard to strain and hear what was being said. And especially in this noisy, busy world we live in, it's difficult, it's hard. So I think that's why it's kind of not seen as the an overall part of hearing health, because it's just like, oh, well, I just can't hear, I'll just ask for repetition. But there's so much more under the surface.
Not to mention the mental health aspect.
Oh, yes.
Because that can lead to, I think you mentioned depression, anxiety.
Yes.
Not both social and personal anxiety. I mean, it's amazing when you think of something as specialized as hearing loss. It's amazing to think of how that can affect all other aspects.
Absolutely.
You pointed out in your notes to me that hearing care does relate to heart health.
Yeah.
And you pointed out that vascular disease can contribute to reduced cerebral perfusion, microinfarcts, white matter disease, and I said them all right, neurodegeneration. No, it's once again, it's that light bulb moment of, wow, the body really is completely connected. The brain runs everything, and the brain is constantly trying to compensate for, I guess I'll say deficiencies, I don't mean it offensively, but deficiencies from other parts of the body.
Right.
And you never think of how does that translate, in our case, to heart health.
Right.
So let's get into that. Explain what I just,
Yeah.
for the folks at home, explain what I just read.
Yeah, so, and it was actually interesting for me because I knew I had heard of, and especially in learning in school, the link between the two as far as heart health. And I feel like if your heart's not healthy, the rest of the body's probably not healthy. But to think of heart health connecting to hearing, you're kind of like, I don't see the relation there. So vascular disease, essentially, it affects blood flow to the brain, right? And it can also affect or cause those micro mini strokes. And it can affect how one part of the brain communicates with the other.
Yeah.
So if you imagine if we have hearing loss also, and the brain is deprived of that auditory stimulation that it was once used to, on top of the effects of the vascular disease, the risk factors for cognitive decline have just exacerbated, right? They've gotten worse. So by treating your hearing loss, that's at least one level of that neurological strain that we can alleviate. So that's how it makes sense that to take one less thing off of the list by treating your hearing loss, it is the #1 modifiable risk factor as far as especially cognitive decline to alleviate your risk for that.
Your peers in cardiology, do they recognize this, or do you sometimes have to make the connection for them too?
Good question. Yeah, I don't know. I don't know if they have that link or if they are aware of that connection. Or if their main focus would be on the heart, but that'd be an interesting
that would be
thing to chat with them about for sure.
Yeah. So I never thought of the microstroke aspect of it, the mini stroke aspect of it. Yeah, that's fascinating how that connects. Sorry, I'm thinking out loud as you're saying it.
Yeah, no, you're good.
So you mentioned that it's not just the heart events that it can play a role in, but hearing care does relate to heart health overall. You talked about vascular disease, but what about let's review that again. It was such a great point. When you combine vascular compromise plus auditory deprivation plus social isolation, and when you were saying that, it kind of connected for me the cognitive aspect of it all. Let's talk about that.
Yeah. It all goes back to the brain hearing.
Right.
It is the brain hearing, not your ears. So if part of the auditory system is damaged in any way, and it's usually the inner ear. There's 3 parts to the ear: the outer ear, the middle ear, and the inner ear. And that's where we can determine if there's a breakdown occurring, where is it occurring? And for most of my patients, it's the inner ear, meaning it's permanent, it's nerve damage. We need hearing aids, we need amplification. So if you have hearing loss on top of any sort of vascular disease where the blood flow to the brain is being affected, well, that's even more strain on the brain. So if we can at least treat the hearing loss, that's going to alleviate at least one layer of that neurological strain on the brain, so that, then maybe that patient will want to go out and communicate and do the things that they used to enjoy doing, and that, fulfills and improves their quality of life. So it really is a full picture of overall healthcare.
That's amazing.
Hearing
That's
is.
amazing.
Yeah.
Have you seen people's mental health improve as well?
Oh, I think so. Patients that have hearing loss,
You mentioned the isolation.
yeah, and you mentioned anxiety earlier, and it is very anxiety inducing, especially the noisy, busy world we live in, and people don't know how to communicate effectively face to face in our day and age because we don't have to, right? So someone that has hearing loss and even wears hearing aids, it can sometimes be, stressful, if they can't see the person's face, if the person isn't really moving their mouth a lot when they're speaking, if they're not enunciating their words. I mean, the pandemic definitely taught us the masks. Patients were, like, I cannot hear anybody because of the masks, because we all understand better what we're hearing when we have a visual. So we all communicate best when we can see one another. So it's definitely anxiety inducing. So it's so helpful if they can, treat their hearing loss and know that, okay, I've got my hearing aids to help me. I'm going to be able to communicate more effectively in this situation, right? I tell patients all the time, there are a lot of variables working against you as a hearing impaired person, again, in this noisy, busy world we live in. But at least the one variable we can try to control or make better is the hearing loss.
That's great. Now if we could just get actors to stop mumbling in movies, right?
Yes, closed captioning is huge. I don't have hearing loss and I watch TV with closed captioning because, again, it reinforces the idea that we understand better what we're hearing when we see it. So that's a big deal.
Yeah, interesting. So treating hearing loss may remove at least one layer of that neurological strain. You gave me a study from The Lancet. I want to talk about that. This is fascinating. It was the ACHIEVE study. What does that ACHIEVE stand for?
The ACHIEVE.
I hope I didn't put you on the spot there.
No, I'm like, oh gosh. The ACHIEVE is,
the Aging and Cognitive Health Evaluation in Elders. And of course, I would imagine, given the demographics of our area, that a huge portion of your patient population is the elderly.
The elderly, yes. I would agree with that. And the ACHIEVE study is this big hallmark study that you will hear hearing care providers and audiologists comment on and talk about all the time because it was a really big deal. So this was in July of 2023 when they published their findings.
Very recent.
Yeah, very recent. And it was the first time someone really looked at if we provide hearing intervention, will the risk of cognitive decline be affected on adults that are higher risk for cognitive decline? And what they saw was that in those older adults in that group, over a 3-year period, their rate of cognitive decline was reduced by almost half, by almost 48%. It was reduced because hearing intervention was utilized. Now, the thing to keep in mind with the ACHIEVE study, because you will hear people comment on it and quote it and cite it, and it's great, it's a great study, but the thing to remember is the control group were very healthy adults, right? And there was no real effect or change. The adults that were at risk had vascular disease, diabetes, heart disease, high blood pressure, had a history of smoking, right? So those, which a lot of people in the world have those things. So again, if hearing loss is on top of that, it's like, oh man, if we alleviate the hearing loss, that's going to reduce your risk of cognitive decline by almost half, by 48%.
That's remarkable. Thank you for providing it. It's so easy to quote studies like through the Bible.
Right,
and,
you really have to look at it.
So what are your anticipations for upcoming technology when it comes to the auditory technology that's out there? We've talked about Bluetooth, we've mentioned AI.
Yes.
Where's it all taking us? Is there a foreseeable future when even folks who are born with hearing disabilities, when that can be cured? Is that
cured, yeah.
Is that cured or reduced?
Sure, yeah. I know that they have been researching it for decades and decades. One of the things that they've been trying to do deep inside the cochlea, which is our hearing organ, there are hair cells or stereocilia. And that's typically what can cause hearing loss, especially from noise exposure. But even at birth, maybe the cochlea is not fully developed or the hearing nerve isn't there. There's a lot of different things. But the point of the research and the studies with the hair cells is to try to get them to regenerate or grow back. Because once they're damaged, and there's no bringing them back. So I know that they have been studying that for a long time. So whoever figures that out, that'll be helpful. And then the devices themselves, I mean, are just constantly evolving, and AI especially, I think it's affecting every industry.
Yes.
And it's making the hearing aids smarter.
Yeah.
They're able to analyze the environment quicker, make adjustments quicker. They're honestly like Fitbits for your ears now.
Yeah, I hear it.
They track your heart rate, your steps, maybe not your heart rate yet, that's coming. No, I think they do. But they track your steps, your activity. They're becoming like Fitbits for your ears.
That's
so
amazing.
it's kind of a all-encompassing device.
I remember the first time I was even aware of how advanced, because I was younger and I just
Sure.
assumed hearing aids, blah, blah, blah.
Yeah.
There was a prominent broadcasting personality who went completely deaf.
Yes.
And that was the first time I'd ever heard of a cochlear
Yeah.
implant.
Mm-hmm.
And I remember listening to this personality talking about the cochlear implant
Mm-hmm.
and describing how he was able to hear voices,
Mm-hmm.
music, it was a little tinny.
Mm-hmm.
How sophisticated are those implants?
Oh, yeah, the cochlear implant has come a long way. I know the surgical procedure itself, when it first came out, there were a lot of trials and tribulations with that, but it is very sophisticated now. To my knowledge, it's like a one-day procedure. You go in, get the internal part implanted. I think you potentially leave that day, if not the next day, and then you go to your cochlear implant audiologist. I think it's about 2 weeks later, and you have your cochlear implant activated. So they have come a long way as far as the cochlear implant technology.
Yeah, the first time I heard about it, I was just like, that's when I really started to realize that, yes, there is permanent damage that happens to the body that can't be recovered, but we're just beginning, and this was early 2000s, we're just beginning to uncover just how undamaged the body, how certain things that happen to you can be reversed. And I think you've done a great job of outlining that for us today. So are there any stories you could share with us? We've been pretty technical here, and you've done a wonderful job explaining it. If I can understand it,
Thank you.
anyone out there can understand it.
Yeah.
But you've done a wonderful job. Are there any stories from your experience? I won't ask you how many years you've been at it.
Yeah, no, it's okay. I'll tell you.
But, well, how many years have you been at it?
So, yeah, I've been an audiologist for about 8 years now.
Congratulations.
Yeah, thank you.
And so I was just wondering, what are some of the stories, when you're having one of those rough days, have to get up, what motivates you? What story, what have you seen in the past that is like, okay, I know you love what you do, but you're having that rough day and you're like, this is why I keep going. And it could be like a general observation that you see a patient that you see progress. Yeah.
Sure. Yeah, I think the biggest motivating factor for me is to make sure patients are counseled and educated appropriately. We are in the day and age of information and we can access it easily, which is great, but sometimes that can have the opposite effect, right? So it's my number one goal to make sure that patients are counseled and educated on the appropriate ways to hear better. I think hearing health, some of it has become commoditized. And
What hasn't?
Right, exactly. What hasn't? And that's not my goal or our goal. So if I see a patient, maybe talking about, I bought this hearing aid online, it didn't work, or I had a patient today actually send me test results from somewhere where he was tested in a different state, and there was a whole integral part of the test missing that the facility just didn't do. And I thought, well, that's a disservice to that patient, So I think that's my big motivating factor. Being a business owner is a lot, but I love it and I wouldn't change it. And that's the biggest thing. I want to make sure that people are counseled and educated appropriately about their ability to hear, what their options are. Patients don't want to be sold to, and that's kind of what my industry, a lot of it has become. So yeah, that's my biggest thing, and making sure that, people, the ability to hear is a big deal, and people don't realize it until you can't. So to be able to restore that and help that patient communicate and understand how important their hearing health is my biggest motivator.
Always being armed with information. I'm always amazed when I talk to not necessarily audiology patients, but when I talk to patients who are just in the regular healthcare system, how little they know
Right.
about what's going on
Yes.
with their own health. So,
Yeah.
so how much of education is part of the process for you?
Oh gosh, I'd say like probably 95%. Yes.
Right, because when they're armed with information, they can
Right.
make the decision.
Right. Yeah. Yeah. My number one goal, like I said, is to counsel and educate my patients. I mean, from the time they walk in the door, you know, I am explaining each part of the test, what I'm doing, why I'm doing it. You know, we give a thorough explanation of the audiogram, which is the chart that documents how much hearing loss they have. And then we come up with a treatment plan for them. And sometimes that solution is a hearing aid, sometimes it's not.
So it's a very collaborative process.
Yeah, oh, definitely, absolutely. And educating them on insurance. Yeah. Insurance is an evil monster that we all have to try to understand. And especially when it comes to hearing and hearing health, it's even more confusing. So I try to counsel and educate my patients as best as I can. You know, here's the help you have, here's what it means, and help the patient in any way I can.
Well, you do get into the weeds, don't you?
Yes, I do. Mm-hmm.
That's great.
Yeah. Mm-hmm.
Finally, those of us who haven't sensed any hearing loss, what can we do to protect our hearing?
Yeah.
And should we be getting routine checkups beyond just our general physical ear?
Yeah, I think the idea of protecting our hearing is actually becoming more popular.
Yeah.
You will see my generation and younger at concerts with even foam earplugs in. So that's an excellent way to do it. And those you can buy at any pharmacy. So they have like big packages of them. So just make sure you roll those down really good and pull your ear up and back. Protecting your hearing around hazardous noise would be the biggest. And then I'd say around, if you're not experiencing any difficulty hearing, probably around 50, 55, we need to start making that a part of our annual checkups. Have your ears checked for wax, have your hearing tested, so that we have a nice baseline and check it every year to every 2 years.
Sorry, I always have thoughts occurring to me.
That's okay.
So we're in a world where we've got earbuds, headphones on.
Oh, yes.
What are the best headphones to wear if you're going to be listening?
Yeah, that's a good question. I wouldn't know, like, as far as brand, like what's best, like one versus over the other. But as far as, I need a link. But I know a lot of people are iPhone, right? So we have AirPods, and they even have the over-the-ear, I think, devices now. Yeah, and the iPhone and technology being the way it is, it will tell you if you're listening to it too loud.
So listen to that.
Yes. So when it's telling you, so usually I think it alerts you at around 85 decibels. It'll say, hey, this might be too loud. The other thing to think about is the duration, how long you're listening to it at that level. Gotcha. That will also have an effect over time. So the rule of thumb with AirPods, anything in your ears, you should be able to hear whatever you're listening to and have a conversation with someone next to you.
Gotcha.
That's how low the volume should be. But when you have something in your ears, you're probably not wanting to talk to someone next to you. So just be mindful of that.
I love those noise canceling headphones because they're cushioned and the sound isn't right on top of it. But I also know when to take them off. Your ears do signal to you when they're tired of having them in.
Yeah, you kind of get that fatigue of like, okay, I'm done, or just the physical, pain from the device on your ear. So definitely taking breaks is good.
Well, thank you so much for being here. Any other thoughts you'd like to share with us, or anything that we didn't cover?
I don't think so. I think we did it. Okay, great.
I think we gave everyone a crash course.
Awesome. Yeah, perfect. Me too.
Thank you so much for all the work you're doing in our community.
Thank you.
Thank you for being thank you for being our Crimson Connection champion. You're great. From last year, you're a great representative of the program and everything we're trying to accomplish with that.
Thank you.
Thank you.
Thanks.
And thank you for watching. We'll see you back here on Trinity Talk next time.